we're speaking today. This is Eric Reese from eyecarepro.net, and today we're speaking with Dr. Gesford from Complete Eye Care in Belmont, North Carolina, and she's going to talk to us a little bit about vision therapy, right?
Yep.
Okay, so I think the best place, if you just tell us, just for a minute about, how you got into this field, how you got to this practice, and just your background.
Sure. So, what got me interested in optometry and in vision therapy specifically was the fact that when I was a young child, I had issues with my vision where one of my eyes turned outward. And I completed a program of vision therapy, which was very successful. My eye no longer turns, and I have much better control over my visual system. And that really inspired me to get involved with this field to help patients who had issues with their visual systems as well. So when I began optometry school, I had this area of specialty in mind. And when I graduated from optometry school, I completed a residency specializing in vision therapy, working with children and adults of all ages with a variety of different visual problems. And after I completed that residency, I joined this practice in North Carolina, where I currently have an active vision therapy clinic as well.
That's a great story because that's like it's very, I guess, personal, heartwarming. Like you're dedicated your whole life so other kids will be helped like you're helped. That's pretty neat. Um, so you seek different people of all ages. People come to you for vision help with vision therapy. How do they find out about you, and what are you helping them with?
So patients get to me through a variety of different ways. Some of them are referred by their optometrist. They also are often referred by their occupational therapist or their physical therapist because they're very involved with looking at the visual system and noticing if there seems to be a problem. Other patients just start talking with other people they know or researching on the internet, comparing different symptoms that they're experiencing. So some of the common symptoms that patients come to me complaining about are double vision, blurred vision, difficulty with focusing on different objects, whatever task they're trying to complete. Specifically for children, it can create problems with their learning, especially in reading. And what we notice with kids is they'll tell me they skip words when they read, or they have trouble following along the line of print and remembering what they're reading, or it looks like things are moving around to them and it's not staying very stable. And then this results in issues with academics because their reading comprehension suffers as a result.
Okay, very very interesting. Um, so what is vision therapy? What are you doing in your sessions that are helping people?
So, vision therapy is a series of different activities that are mainly designed to improve the function of the visual system by training the eyes to work together better and to work together better with the brain as well, so that visual information can be processed more efficiently and more accurately. So, the activities start at a level that's relatively easy for the patient, and then they gradually build upon each other. And as the visual skills develop, they become automatic. So the changes are actually occurring in the brain, and this is how this level of automaticity is achieved. Once changes are made in the brain can better control what the eyes are doing, be it working together better, focusing better, or any area that was difficult for them prior.
Okay. And is how long do they do these sessions for? Is it like they do it for a year? Is it ongoing, like they do it for a year and then they have to keep coming back just to make sure it stays?
So the nice thing about vision therapy is compared to other therapy programs like with occupational therapy, physical therapy, or speech therapy, it's usually a relatively short program. Typically, I see patients anywhere from 4 months to maybe 10 months at the most, either once or twice a week for 45 minutes to an hour, depending on the condition. And the patients have home assignments as well for about 15 minutes a day where they'll practice some of the activities we do here. And then the follow-up period is typically on a monthly basis to make sure everything is progressing as it should be and make sure, most importantly, that their symptoms are getting better. And then after completion of the program, typically there's no maintenance needed. And like I said before, once these skills become automatic, they have these skills for life and tend to not regress at all.
Okay, that's pretty neat. Um, okay, I think I have two more questions for you. Is it only for kids?
No, vision therapy is not only for kids. We used to think that it really only was for kids because the brain had a critical period of where it could stop making changes and stop developing. We used to think this was around age 7 or 8. But the current research being done in neurology and with neuroplasticity shows that changes can be made into the brain well into adulthood. And we're finding with a lot of patients who've had traumatic brain injuries, such as stroke is a really common one, that they are able to be successfully treated with vision therapy as well. So there is no age limit to who can be helped by vision therapy.
Okay. And then just my last question is, I imagine, you're helping people every day. Like, did you have any stories? Like a kid finished and he was having such a hard time reading, and now, like, it's just all the teachers are saying it's great. The parents are so happy. Like, have any stories like that you could share with us?
Sure, yes. One of my favorite patients I worked with at my current practice, he came to me actually with a very high IQ. He started kindergarten a year early because his level of intelligence was way beyond his age level. However, when he got to second grade, school became a huge struggle for him. He started to hate school. He didn't want to read. He did not want to do his homework. His attention was poor. A lot of different issues going on. And his mother brought him to me looking for answers and looking for help. And it showed that he had several issues going on with his visual system. His eyes were not working well together and they were not tracking appropriately, which, as I mentioned before, is very detrimental to reading performance. And he did exceptionally well with vision therapy. He completed approximately 5 to 6 months of therapy, I believe it was. And afterwards, his mother and his teacher do not have enough good things to say about it. He's reading at grade level. He's completed all of his accelerated reader goals. He reads for pleasure now, and it doesn't take him hours to complete his homework anymore. And one of the biggest benefits that I think comes out of vision therapy, that particularly with this kid, is just seeing how confident he is now. He's not afraid to tackle his homework and afraid to read, and he's just much more confident and much happier kid.
Okay, thank you for taking the time to speak to us today, and I learned a lot, and it sounds like you're doing really great things.
Well, thank you. I appreciate it.